knee problem is several structures that can be injured. It's a lot of common problems here with sporters. You have could have arthritis picture underneath the patella. You can have ligament injuries on the medial side, either the lateral side. You can have a jumper's knee affecting the quadriceps, the patella tendon, or you can even have a runner's knee affecting the tractus iliotibialis, connecting on the lateral side. Those are several diagnoses who can have a really good beneficial effect of using the Skanlab Tacard Pulse machine for treating. We're going to focus on the medial ligament injury. We also have meniscus here. We have cruciated ligaments in the joint, but let's focus on the medial ligament as well now. Ligament collaterale mediale. Very common injury, like get a bump and overstretching, get a strain in the fibers here. Treating this is more a local treatment than other treatments because you have a really low vascularization in the ligaments, but to kind of restore, optimize the circulation the small circulation and vascularization we have in this area, we use the Skanlab like a pre-treatment. It can also be pain relieving. It can be starting up a process for a regeneration of the fibers to get the patient able to come back in training and exercise again. We don't see too much swelling in this area with those kind of injuries, but some small swellings will occur, and or out of that is of course very beneficial to using the Skanlab, the Tacard Pulse as well, to get a resorption of the edema, which is most common edema, not in bleeding. And preparing the patient for this, we use, in this case, I think the solid return electrode is very beneficial to have underneath the knee. Put some cream on it first and put it underneath his knee. You can put it from this side so the cable won't be in the way for us. Good contact. The ligament goes from the femur condyle to the tibia condyle, and they also have some fibers attaching to the meniscus in the middle of the joint. But we treat the whole area. So we put some cream on there as well. Then we go on the machine and pinch the knee area. And then we get up those diagnoses I was telling you about, ligament injuries, and okay. We get the preset intensity and the time, and then we just pinch the on button to start the treatment. And here we are working on rather bony structures, not too much soft tissue in between the treatment head and the bone, so it means that the bone will really quick get warm. Is it too warm, sir?
It's okay.
It's okay. So we have to regularly ask the patient if it's getting too warm so we can decrease the intensity if necessary. It's okay still?
It's getting warm.
Now we go down one step. Sometimes I even go down 2 steps in a row here because we are so close to bony structures. Is it too warm still?
It's okay.
It's okay. But maybe in 5-10 seconds more now it will be too warm again. It's okay, sir?
Yeah, it's getting a little warm.
Yeah, we go 1 step more. And so we continue working this area. This we also of course combine with other form of exercise to stimulate the total mass of muscle activity in the thigh as well, to help the circulation to resorb the edema has occurred. And if this was the time tells us, so now we can stop the treatment. We have used the full time. If this was a subacute injury, I should, if possible, try to treat him every day. At least every second day I should be treating to get as quick as result as possible. And of course we have to be aware, is it a strain in the ligament or is it totally ruptured? If it's totally ruptured, we only use this treatment to get reduce the swelling and reduce the pain. But if it's a strain in the structure, we can use the Skanlab, the Tacard Pulse to get it to regenerate quicker again. After that, during this treatment, we have to clean the area and take away this solid return electrode, take away the cream on this one and the treatment head. I also use some spiritus and disinfection to clean this my tools, preparing for next patient. And then I have to clean the area on the patient as well. Could be a little bit difficult to see exactly where the cream is on the back side, but more or less we are able to reach the most of it. And then we take some disinfection or water to get rid of the rest of the cream in the area. Okay.